Hey, welcome to Greg Morton Outdoors. Hey, today let's take a few minutes to talk about cold weather injuries. Hey, we've got winter fast approaching us here within the next few months. Some places up north, you're actually in the midst of winter as it is now. So let's take a few minutes to talk about 4 cold weather injuries, and we'll discuss what they are, how to identify them, and how to treat them. But first, if you haven't already done so, please subscribe to the channel and click the notification bell so you know when I post new content. Now, as we discuss these injuries, we're going to start with the least threatening, the non-freezing type, and then we'll progress to the most severe. Now, I have to warn you right now, I'm going to have some pictures in here of these injuries. So if you're bothered by seeing things like that, you might want to turn your monitor off or just listen to this instead of watching the video portion of it. All right, so let's get started. First on the list I want to talk about are chilblains. Chilblain is a non-freezing cold weather injury, and it can occur anywhere from like 1 to 5 hours in cold, wet conditions. Mostly when the temperature on your skin is around 32 degrees and lower. The commonly affected areas of this are like your hands, your fingers, your ears, your face, your nose. Those things are kind of normally exposed to the cold weather. The good thing about chilblains is there are no lasting effects from it. So once you treat it and take care of it, hopefully it'll never come back. So what does it look like? Well, the chilblain lesions are swollen, they're tender, they're itchy, and they can be painful as well. Now, when the skin's getting re-warmed, it can swell and turn dark red. For dark-skinned people, it'll be just a darkening of that skin, and it can become hot to the touch. You might have an itching or a burning sensation. It may continue for hours after you get the exposure and start warming back up. The thing with chilblains is you're not going to know that's what you've got really until you start going through the rewarming process. So how can you prevent it? You know, one thing is to use gloves whenever you're handling equipment and keep your hands covered in cold areas like that. Same thing when it comes to your face and your ears. Make sure you've got a good hat, or in this case it's a balaclava that can cover up the exposed skin. You know, and here's something, I know you heard it a million times, you know, the old saying that cotton kills. Same thing here also. Don't wear any cotton in the cold weather because, like people have said before in the past, it acts like a sponge and it's going to trap that moisture in. All right, number 2 on the list is immersion foot, also known as trench foot. The cause of it is prolonged exposure, especially your feet, to cold, wet conditions. And the thing is, it doesn't need to necessarily be freezing temperatures either. So anywhere from the 30s all the way up to the 60s. So also inactivity and wearing damp shoes or socks and tightly laced boots and shoes, that can really exacerbate the situation and have it set on a lot earlier. What are the symptoms? Cold, numb feet that may progress to becoming hot with some shooting pains. Swelling, redness, bleeding may happen too, and your feet might turn pale or blue. It might be all cracked up, and you know when you're in the water for a long time and your hands get all pruny, your feet are going to look like that too. Except there's going to be a lot of pain with this. You can have aches, and if not treated, you're risking infection. So how can you prevent immersion foot? Keep your feet clean and dry. Change your socks often when they get damp or wet. Make sure you get your shoes and boots dried out. It also helps if you can stuff paper towels or toilet paper inside your shoes. That'll help dry them a lot faster. Make sure you take out any inserts too, because that just traps the water in. And definitely avoid wearing any footwear that does not breathe, that traps in moisture. You don't want any of that. So how are you going to treat immersion foot? You're going to get that wet socks, wet shoes off, all of that. Make sure, and if your feet are dirty, make sure you gently wash them off and dry them. And then you want to elevate your feet and cover them with several layers of loose clothing. So if you're actually out in the backcountry, elevate your feet, cover them up with like your puffy jacket, your sleeping bag, or your quilt, extra layers of clothing. anything you might have handy with that. Now, don't rub them, don't pop any blisters, don't put any lotions or creams or anything, because that can make things worse. But here's the bad thing, is that your hike's over, your trip is over, you need to get off trail, and you need to have this treated as soon as possible. Try not to walk on it until your feet start to feel a little bit better, but you definitely need to get medical attention for this. So number 3 is one that I'm sure you've heard of, and you might even know some people that have had it, and that's frostbite. Frostbite accounts for the most cold weather injuries every year, and this happens when the tissue, your exposed tissue, falls between 28 to 30 degrees. Now, frostbite most commonly happens in exposed skin like your hands, your nose, your ears, and your cheek, but it can happen in your feet and your hands even when you're wearing gloves and socks and everything else. And a lot of that has to do with inadequate blood flow to your skin. So when you're out there, make sure your feet and your hands aren't too cramped and restricted from whatever you're wearing. So what are the symptoms? You've got numbness in the areas that are affected. You've got tingling, blistering, swollen, tender areas. It might look pale or yellowish, almost kind of waxy looking. The frozen tissue might feel like wood to the touch. And there's a lot of pain after you start to rewarm it. So what can you do to prevent it? Keep an eye on the wind chill factor and how that affects everything, but keep exposed skin covered, especially things that are susceptible, like your ears, your face, your cheeks, your hands, and your toes. Make sure you're taking care of all of those. Constantly check yourself. Make sure you've got on good, clean, dry socks, and that your footwear is clean and dry also. How can you treat this? You can immerse the affected parts into warm water, roughly about 100 degrees. You don't want to get too hot. And normally that's pretty effective. Minor cases, you can rewarm it against your own body. Put your hands on your armpits, down in between your legs. Or you may need assistance of a friend and be like, hey, can I stick my feet there, under your armpits or something? Or whatever you got to do to warm up those areas there. Just be careful. Do not put them very close to a fire or something like that. Remember, the affected areas are numb, so you might not realize how hot they are getting, and then you end up singeing your skin, making things a lot worse. One thing to keep in mind with frostbite is if it happens, you could be at risk for the next cold weather injury that I'm going to talk about, which is the most serious one, and this one is a killer. So we're talking about hypothermia. Hypothermia is when the body's core temperature drops below 95 degrees. Now, it is categorized as mild, severe, or moderate. However, the only way you can tell which one it is through the use of a rectal thermometer. And I know nobody watching this video right now takes a rectal thermometer with them when they go backpacking. Now, hypothermia, like frostbite, can occur suddenly, such as partial or total immersion in cold water, or can happen over a period of several days. Don't think hypothermia is only going to happen in freezing temperatures. A lot of it has to do with, you just being wet in colder temperatures. And remember, the wind chill factor kicking in too. So even though you live down there in southern Georgia, you're still susceptible. So what are some of the symptoms of hypothermia? One is a vigorous shivering. However, as your core temperature starts to drop, that shivering might dissipate. One good thing to keep an eye on is what they call the umbles, such as grumbles, mumbles, stumbles, and fumbles, because this affects not only your muscles, but also your nervous system as well. So keep an eye on yourself or the people you might be with for symptoms like this to show up. Some other things that might happen are confusion or sleepiness, slurred speech, it could be some shallow breathing, weak pulse, and really bad motor control of your body. So once again, keep an eye on yourself, keep an eye on your friends, look out for these symptoms. So what are the preventative measures you can take? Keep this acronym COLD in mind. So you want to keep it clean. Make sure your clothing is clean, especially with things like Gore-Tex. When the fibers get clogged with dirt, they fail to work and they're not going to evaporate that sweat from your body. The O, avoid overheating. So you don't want to get that big time sweat going on while you're out there, because that's going to really, put yourself at risk by getting all your clothing damp. Next, you want to wear it loose and in layers. So you don't want anything that's going to restrict the blood flow to the skin. You want to have it nice and loose so you're trapping air in between your layers. And definitely layer. Do the base layer, the mid, and then the outer layer or shell. But you know what? Don't think you only have to wear 3 pieces. So if you want to have on, long underwear and, a fleece shirt and a heavier fleece and then a puffy jacket and then a wind shell, whatever you need to do to keep yourself warm and dry. And lastly, you want to keep it dry. And this is especially important when it comes to your socks. Make sure you're swapping those out as much as possible. I know a lot of us, when we go backpacking, we only might take 2 pairs of socks, and that's one that you've got on your feet and one that you sleep in. So in the wintertime, you might want to take 3 pair, your sleep, your hiking pair, and then a backup. So how do you treat hypothermia? Well, a lot of times when you catch it early on, you can generate your own heat through shivering. Also try and do some exercises, maybe some jumping jacks or running in place, but whatever you need to do to generate that body heat to now warm up your core. Also keep in mind while you're doing this, you're burning calories and you're also going through fluids. So make sure you're drinking, make sure you're eating. You've got to replace those things. In more severe cases, you can use external heat, such as, take your Nalgene bottle and put hot water in it. You can hug that, cover up with as many layers as possible. Nice dry things like your sleeping bag and your puffy jacket. If you've got those hot hands warmers, that might be something too. Put one on your chest, have one on your back, something like that to help warm up your core. And if it's really in a severe case, you might have to do some body heat with somebody else. So if that happens to be the case, just remember your life is at risk, and it's only polite that when you're snuggling up with your best hiking buddy, well, you get to be the little spoon. So don't be scared about possibly having an injury like this. All this can be mitigated by just, keeping your clothes warm, keeping them dry, making sure you're checking on yourself and checking on your friends. And one thing too, when you're out there and you're doing a lot of moving, whether it's snowshoeing or hiking or skiing or whatever, and you decide to stop and take a break, it's always good to have access to something like your puffy jacket so you can put it on over top you when you stop, because I guarantee you get some sweat going, and this will help trap the heat in and keep your body from cooling off very fast. So hey, there we go. Those are the 4 cold weather injuries. I hope you got something out of this. If you did, please hit the like button down below. Don't be afraid to get out there this winter. Keep having fun. Get into the backcountry. Maybe try something new like snowshoeing, which I'm kind of thinking about doing this year. But all right, folks, that's about it for me. We'll talk to you soon.